The Kennedy Forum is a national nonprofit that's working to erase the stigma of mental illness, substance abuse, PTSD, and TBI. Paul DIllon is a Vietnam veteran and a member of the Leadership Council for the Kennedy Forum, Illinois. What does the Kennedy Forum do, Paul?
The Kennedy Forum is a national nonprofit organization that was started in 2013 by former Congressman Patrick J. Kennedy. And it has several functions, one of which is to form a new paradigm for healthcare in this country by seamlessly merging mental health care with physical care. Patrick Kennedy has this great line, and I think it sums it up very well, that when you go in for your checkup, your annual physical, you should also get a checkup from the neck up. And I think that that's one of the functions of the Kennedy Forum, is to bring mental health care together with physical health. The second objective, which is very important, is to help businesses form alliances with government, labor, the nonprofit sector, to do two very important things. One, erase the stigma of mental illness in this nation, and also as that pertains to veterans, and also ensure mental health parity, that mental health be treated by insurance companies and providers in the same way that physical health is treated. And that sums up the purpose of the Kennedy Forum, I think, in a nutshell.
Now, you're a Vietnam veteran. This was not available back then. This became in 2008, where this became more of a mandate to try to establish the mental health and the physical health parity. What is it that got you involved in this, though?
I had known Patrick Kennedy for a number of years, and I'm not a clinician, but I had a policy background in mental health. I served 9 years as a trustee of the Chicago School of Professional Psychology, which is the largest independent nonprofit graduate school of psychology in the nation. And I also served for 3 years as a public member and commissioner on the National Commission for Case Manager Certification, with certified case managers in the psychological services, as well as the physical health services and social services. So my background is from a academic and policy making viewpoint. But being a veteran, I understand the importance and the critical importance of erasing the stigma of mental illness, post-traumatic stress, traumatic brain injury into our veteran population, and ensuring that those veterans who are employed or get their health care outside the VA system understand that there is parity. They need to know their rights, and anybody can go to the kennedyforum.org and look at some sites that are there. Parity Track is one of them, and there's others, and get to understand their rights. So that's how I got involved with this wonderful, wonderful organization.
Well, hopefully we're closer to finding a solution to solving the mystery of PTSD and TBI when it comes to even that parity as well, making that happen. Thank you so much for being here today.
Thank you so much, Jeff.